Good day everyone, my name is Oliver. I'm an integrated expert at the Ministry of Planning's IDPoor department, and I have the honor to give you some insights on the Improving Social Protection and Health project of GIZ. So what is protection? What does it mean? Actually, protection is anything that prepares harm to a person or a thing. Like in this picture, the Cambodian king giving a helmet to children or brushing teeth to protect against caries decay. There are many types of protection that are formalized and organized by the state and organizations, such as cultural heritage protection to preserve the characteristics of a civilization, environmental protection to keep our mother nature clean for us and others, health protection to ensure physical, mental and social well-being. Social protection is a human right to reduce and prevent poverty and vulnerability. People in special conditions such as disability or shock, they need support throughout their whole lifetime. And they should not fall into poverty, they must receive support if they are living in poverty, and they must be helped to escape poverty. In Cambodia, the National Social Protection Council, NSPC, is responsible to oversee, steer and coordinate social protection efforts. The ISPH project supports NSPC to strengthen Cambodia's social protection system with regards to shock responsiveness, inclusiveness and service quality. The social protection system in Cambodia is provided by many different actors. There's the Ministry of Planning, the Ministry of Social Affairs, the Ministry of Health, the Ministry of Labor and Vocational Training, the National Social Security Fund for formal sector workers, another one for civil servants, and a national fund for veterans. NSPC defines two systems of social protection: social assistance, which does not require beneficiaries to pay into a scheme. Services are provided based on eligibility criteria such as being poor or disabled or affected by flood. And Social Security, which requires the beneficiary to pay into a scheme. Social assistance schemes include, for example, emergency response, human capital development, vocational training, welfare provision to the most vulnerable people, and social security schemes are pensions, health insurance, work injury insurance, unemployment insurance, and so on. Here's one example for social assistance. It is the cash transfer for pregnant women and the COVID cash transfer. Poor households are identified by the Ministry of Planning. The Ministry of Planning shares the data with the Ministry of Social Affairs, and the Ministry of Social Affairs provides cash transfer to identified beneficiaries. A second example of social assistance is the Health Equity Fund. Poor households are identified by the Ministry of Planning. The Ministry of Planning shares the data on a daily basis with the Ministry of Health, and the Ministry of Health covers the health expenditures of poor households through the Health Equity Fund. Now an example on Social Security. These are pension schemes. Formal workers pay into the National Social Security Fund during their work life, and all who have contributed into NSSF will receive a pension after their retirement. So, how does ISPH actually support the National Social Protection Council and the social protection system? First of all people eligible for social protection need to be registered to be able to receive benefits. ISPH works with NSPC and MOP to build a more comprehensive registry system to ensure everyone that might receive benefits is in there. People in need of social protection need to be aware of their rights and the services offered to them. So ISPH has supported the NSPC to set up a communication strategy and a broadcasting mechanism to raise awareness about all aspects of social protection through various communication channels. ISPH also works with NSPC and service providers of social protection schemes to improve the inclusion of vulnerable target groups, especially vulnerable female households, people with disability, and the elderly. To make the social protection system more shock responsive is another aim of ISPH. People accessing social protection services must be able to provide feedback and complaints about the services they receive. Currently, complaint mechanisms are fragmented and difficult to access. ISPH supports the development of a harmonized complaint management system that will include MOP, NSSF and MOSAVI. ISPH uses many different approaches to work with the counterparts. We provide policy advice through GIZ advisors and integrated experts and consultants. We provide knowledge and data for evidence-based decision-making, and we cooperate closely with our partners to provide capacity building and monitor progress. We facilitate implementation of communication campaigns and much, much more. Thank you very much for your attention, and I hope this presentation was insightful.